Good morning, everyone. I know that we have a few people who have joined us and more people on the way. Um, y'all know I'm Mandy Pratt-Chapman. I'm here introducing our speaker this morning for our Diversity, Equity, Inclusion, Justice Task Force. And our speaker today is Andrés Gonzalez from Froedtert and Medical College of Wisconsin. I may have butchered that. I tried to practice. Um, but he's going to be speaking today about his work in community engagement, diversity, equity, and inclusion. And I'm going to turn it over to him so that he has the hour, but he currently is Vice President for Community Engagement and Chief Diversity Officer for the Health Network, where he works, which includes 11 hospitals, over 2,000 physicians, and 45 health centers. And in his role, he leads diversity, equity, inclusion strategic initiatives, including business resource groups, community engagement team, diversity action teams, diversity and cultural competence education, health equity, language services, supplier diversity, leadership development, and the list goes on. So I'm going to hand it over to Andres. Thank you so much for being here this morning. Thank you all for joining bright and early. We were just talking about how much we appreciate that. And I'm going to go off camera and hand it over to Andres.
Wonderful. Well, thank you so much, Mandy, for the introduction. Can everyone hear me fine? And can you see me fine? All right. Wonderful. Well, good morning. Thank you so much for inviting me this morning. As Mandy mentioned, I am Andrés Gonzalez, and I have the honor to serve as the Vice President of Community Engagement and the Chief Diversity Officer for Froedtert and the Medical College of Wisconsin. And so what I'm going to do now is I'm just going to bring up the presentation here. I want to make sure that we have a chance to have a dialogue this morning. And I know some of you might be commuting, some of you might be in the office. So no worries. Again, this is being recorded. And so hopefully you'll have a chance to review it later on, and or for those of you who are not able to attend and you will be just solely reviewing the webinar, know that happy to connect offline and provide more details about anything that I've mentioned, or maybe some of the lessons learned or leading practices that I will share with you this morning. Here's what I'm planning to do. I want to share with you the tale of our healthcare system, or the journey of our healthcare system, and specifically how we ended up standing up the JEDI, which actually stands for Justice, Equity, Diversity, and Inclusion strategy here at Froedtert and the Medical College of Wisconsin. I'm going to also make some connections to some of the national pledges that exist, like the Health Equity Transformation Assessment under the Institute for Diversity and Health Equity, which is obviously one of the arms under the American Hospital Association. But I'm also going to put in context here some of the newer standards that we're seeing come down from some of the federal agencies and or accrediting bodies. So specifically, I'm going to talk about CMS, their new framework, and it's not so new, but certainly it's in the last few years, they actually have rolled out a 10-year health equity framework. And I'm also going to talk about the Joint Commission health equity certification or standards there as well. And then we'll talk a little bit about, again, strategic efforts and leading practices. I'm planning to do this for about 35, 40 minutes, and then really engage in dialogue for the last 15, 20 minutes, because I know that that's what many of you came here for this morning, to really chat more about, hey, I have this question, or I have been thinking about this particular practice. What are your thoughts, or what are your lessons learned around that? So I will do that. As Mandy mentioned, we have nine hospitals, 50 locations. You will see that in the state of Wisconsin here, the lower circle or sphere there, kind of in the Milwaukee, Racine area, that is Froedtert and the Medical College of Wisconsin. As of January 1st, we went live with a merger that where we actually acquired or joined forces with ThedaCare, which is actually in this Fox Valley area, kind of Appleton area, and that's now our North region for the healthcare system. So our new legal name is Froedtert ThedaCare Health Inc. And so I'm still getting used to pronouncing the new name. But for this particular presentation, I'm going to be speaking about the South Region market, i.e. Froedtert and the Medical College of Wisconsin, because that's where actually I have resided for the last 8.5 years. That's the part of the system or the market that has had now, a longstanding commitment to justice, equity, diversity, inclusion for over a decade. Now it's about 13 years in the making. By the way, I should have mentioned, we're right now 22,000 employees or staff members based on the new acquisition or integration that occurred as of January 1st. So just giving you a little bit of perspective in terms of who we are, where we reside, the communities that we serve. Something that will be interesting to mention here before I move on is that Froedtert and the Medical College of Wisconsin is a very um, um, urban setting or urban serving health system, if you will. So we obviously serve the greater Milwaukee area, some of the other adjacent communities here, or 5 contiguous counties there, where ThedaCare has been a much more rural-based system. And for those of you who might be thinking or asking the question, well, do they have also ED&I efforts or health equity? They have had a health equity strategy in place for over 5 years. But on the justice, equity, justice, diversity, and inclusion side, they really have not had much going on. So this is going to be part of the new journey for us as part of the new integrated health system. So my teams are going to get very deep into doing that analysis or assessment in the next couple of months, understanding based on the findings what's current state and what will be the proposed strategy moving forward. So know that that's a lot of what's going to go on here as part of this new integration. Some of you might be thinking, well, where do you reside, Andrés? So we're highly matrix at Froedtert. What I'm showing you here is the org structure under HR. So for a big portion of my work, I report into the CHRO, Eric Humphrey. You will see here in the right side of the page here, the slide, you'll see VP of Community Engagement and Chief Diversity Officer. That's me. And you will see that I have obviously my team there, the D&I team there. So I have a internally facing director and an externally facing director. We have a manager of patient equity. That's the person that actually works very closely with a lot of our clinical teams, pop health, health equity proper. And then we have a coordinator that actually leads a lot of the internally facing efforts, especially overseeing our business research groups, doing some of the data analysis and the budget for our team. And then, as Mandy mentioned, I also have responsibilities for community engagement. So we have an executive director for community engagement, Andy Dreesing, and then we have a number of directors there, including volunteer services for the South region. All of that actually rolls up into our function here. And then we also have, quite frankly, as part of this efforts too, I have language services, as Mandy mentioned, and then my externally facing director also oversees supply diversity and emerging markets, which is actually a fancy name for multicultural marketing. Now, I mentioned that I'm dually matrix or dually here, connected to different, to a couple of leaders. So again, I report to Eric on a lot of the D&I efforts, some of the community engagement, but because we have, and you'll see it in a second, a executive diversity council, I also have a dotted line into our CEO, Kathy Jacobson, for a lot of that work. So everything that we take quarterly to the diversity council, I funnel all of that directly to Kathy, and we'll say, hey, here's what the agenda, proposed agenda is. Give me a thumbs up that you're good with it, or if there's anything else that you would like to see or hear, let me know. We'll build that, and certainly we'll go from there. So that's actually how we operate here. We are a functional area or functional areas for the system, which means we reside on the corporate side within the organization. So we're not embedded in one hospital like the academic medical center. We support truly everyone. And that's the same way in which we have been able to operationalize or even strategize about our efforts. We build it at the highest level in partnership with our VP of transformation, the Office of Transformation, that also oversees our strategy or our strategic planning and performance measurement here for the system. And so we bake in or think through that Jedi lens, what are the implications or the elements for each one of those tactics. We built it there. So when we roll out our strategic roadmap for the organization every year, everything has been already baked into the strategy overall. And so all of our leaders understand what's going to be required of them and their teams for that matter. I think that that's actually part of our secret sauce. And I would say that that's probably one of the best, one of the greatest leading practices that I've been able to actually gain over the last 25 years doing this work, this strategic work for a number of healthcare systems in the nation. So that's here our D&I team, as I was mentioning. Just wanted to give you a little bit of context here about who they are, a picture with a name so you know who they are. I have a stellar team, I would say, probably the best team that I have worked for in my career. We're really fortunate that we have a great seasoned team here at Froedtert. Here's a little bit about our infrastructure. As I was mentioning, my diversity council, per our charter, because we have a charter, and I'm more than happy to share the charter later on if that's actually of help to anyone here on the webinar. We, as part of the scope and charge, that's my governing council. So everything that we are driving at the strategic level, we bring to the diversity council. And so you might be thinking, well, who's sitting around that table? So, aside from our CEO, Kathy Jacobson, we have our CFO, we have all the entity presidents. So for the hospitals, we have representation from every single hospital within the health network. They're sitting here around that table. The chief marketing officer sits here. The enterprise-wide chief medical officer is sitting here, of course, because health equity resides under that particular leader, even though the VP of Pub Health, Health Equity, and I are joined at the hip for all of our health equity efforts at the highest level, again, driving that strategically for the organization. We also have on the ambulatory side for our 50 plus health centers, we have actually the COO of that function resides also or area in our diversity council. So we have a group of about, upwards of about 12, 13 leaders here that are sitting in this council. And so again, I take everything to that council. We deliberate, we provide recommendations. Ultimately, they have to obviously approve our recommendations, and that's what sets forth or gets obviously the wheels in motion for all of our efforts for the strategic, from a strategic standpoint for the fiscal year. Under that council, we also have a BRG-DAT oversight committee, fancy term for a cross-functional group of leaders that actually oversee our diversity action team that is comprised of exceptional care and extraordinary people, folks. So we had two different ones about a year and a half, actually 2 years ago at this point, we joined forces or combined those two. So the group now cohesively addresses everything around our people strategy, and they also address everything around our patients and community as well. And this is a cross-functional group of leaders that is a good representation from the entire health network. And so think about them as ambassadors and extensions of our team. So champions, Jedi champions for this efforts. They're localized in each one of their facilities, and they really are paying attention to what's going on there, bringing back or providing us a pulse of things that are going well, things that we need to actually be paying attention to, and things that the DAT needs to actually then strategize around to either provide education, greater awareness, or really dive deeper into some of those opportunities. And then under the DATs, we have the 5 BRGs, and we call them strategically or intentionally business resource groups. And the reason why we do that is because the BRGs are not a nice thing to have, is a have to have. In our structure for us and the way that we created the policy for the BRGs, and they have been operationalized, they really are helping us to solve for some of the most complex issues that we're striving to solve, whether it's actually on the people strategy side around retention, development of our staff, or whether it's around our health equity efforts or community-based efforts based on our community health improvement plans as well. So they are strategically, again, another extension of our office, really working on that. And they're BRG leaders, by the way, for some of you who might be thinking, well, what's the incentive for them? They get credit on their annual appraisal for their efforts. So again, we protect their time. There's actually valued time that they're providing, right, to help us solve for some of those efforts. So they get credit on their annual appraisal. We also have for each one of our BRG leaders an individualized development plan. Again, all of our BRGs are linked to the talent management strategy, which means the BRG itself, that role, will actually serve as an opportunity for them to be promoted over time. So because they're obviously working on stretch assignments, they're obviously showcasing their skill sets, gaining great competencies along the way. So that is actually a role that we value, and we have intentionally also protected or called out as part of the talent management strategy here for their leaders. And then thirdly, we give them also the opportunity to continue to further their development. And so we have both internal and external development leadership programs that they can also access. But that's a little bit about the infrastructure here. As I mentioned, I also have Carol on the left-hand side. That's our director. This is actually just a representation of our team. We have 35 interpreters, live interpreters that we hired for Froedtert for the South region, majority English speaking. That's actually outside of English, our second language spoken or high diffusing language in the region. And then we have Hmong. We have the third largest Hmong community in the nation here. So Hmong would be, after Spanish, the second language. Then we have Russian, American Sign Language, and Arabic. Those are the 5 top languages that we support outside of English. And then, of course, we also provide telephonic interpretation, video remote interpretation. For telephonic and video remote, we actually roll that out system-wide. Those two capabilities are standardized for every single facility that we either renovate or we upstand within the health network, and we'll be doing probably kind of a similar process for ThedaCare over time as we do that analysis. But that's a little bit about our language services team there. And then community engagement here, just a sampling of that team. We have about 20 staff members there. The team is actually divided into 2 teams. One of them is really much more the community partnerships, community engagement, helping us to strengthen partnerships with the community at large and really understanding what are the needs, right, from a community, from a social driver standpoint. What are some of those social determinants or social drivers of health that we ought to be certainly paying attention to and co-creating strategies with the community, right, as well, in terms of solving for those. And so we have a team dedicated to that. And then we have a team that's a little bit much more focused around health equity proper, and they become an extension of our health equity team. And and that includes even our community health worker program as well there. So we certainly have seen great progress being made, or impact, collective impact, with our community engagement team, and really, again, engaging authentically and with a lot of humility our community at large through that process. So a little bit here quickly about our journey. I'm gonna go fairly quickly through some of the slides here, but just want to give you a flavor for our journey, our efforts. What I want to highlight here is when you look at our mission, you see that we called out in red here the diverse communities that we serve. Again, we have been very intentional about ensuring that we're serving everyone in the community, not just some parts of the community. And I think that that is something that we historically struggled with, or was not part of the way in which we engage our community at large. And so over the last few years, over 3.5 years ago, when we were revising or updating our vision, mission, values, we decided that it was important for us to call out that we're serving everyone here, not some parts of the community. So just wanted to make sure that you understood that about our journey. And again, doubling down on our commitment to serve the diverse communities that call, obviously, the greater Milwaukee area or southeastern Wisconsin their home. Here as well, you will see that also intentionally, we have defined what does diversity, inclusion, equity means to us as an organization. And things that are popping out here in this particular slide is things around, again, calling out the importance of culturally and linguistically relevant or responsive care. We're very clear that that's ultimately what we want to do and what we strive for in every single encounter. So it's the N of 1, right? For every single patient, we want to make sure that we're providing that culturally and linguistically responsive care every single time that we are engaging them in one of our clinical settings. So that's part of our journey, our commitment. And there's a little bit about our framework. You will see that this particular kind of a drone, but it's the framework there. Those are the pillars strategically of our health network, at least the South region, so the Froedtert and the medical college. So what we have done is really understand what's the DNA, right? Pun intended here, the thread from a ED&I or justice perspective. And so again, we bake it in there strategically. And so when we roll out our plan for the year, the tactics already have everything called out. We have very clear metrics that have been defined that will constitute success or impact for each one of those tactics. And that's what then comprises our dashboard. And for those of you who might be interested, I would really urge you, and you'll see the link later on here in the presentation, we have both our strategic plan that we title Eradicating Racism, Enhancing Health Equity, and our dashboard, our metrics, out there on the website externally. We want it to be not only accountable, but also transparent with the staff and the community at large, that here's the work that we're committed to, and here's how we're doing, right? So make sure that you are aware of what we're doing, but also, right, hold us accountable to whether we're actually, again, on that journey, whether we actually are certainly striving for that collective impact or not. So we have been very clear around that. So things around our extraordinary people, market leadership, consumer guided experience, all of those things have been baked into those goals. And here's a little bit of a sampling of those particular efforts for those of you that may be thinking, well, give me some examples of specific tactics, Andrés, that or work streams that you guys are leading within the health network. Here they are: improving the experience for all patients through tools and resources that address patients' unique needs, to increasing retention rates among diverse staff and providers. Again, we're calling out things both on each one of those strategic pillars, looking through that justice, equity, diversity, and inclusion lens. And what you will see here is that we're calling out things both that are internally facing or, patient facing, as well as things that are community facing as well for this particular efforts. The M9 there, it's actually the major initiative 9. So all of our efforts roll up at the highest level strategically to one of 11 major initiatives for Froedtert and the Medical College of Wisconsin. That's how we view it as a business imperative here. And so the workforce diversity and health equity strategic goals is one of the 11 major initiatives that we're driving collectively. So there's accountability at all levels. And for our executives, there's also compensation that we tied to the efforts as well. Here's a little bit about, obviously, and I think all of you probably are well versed. So I know I'm probably preaching here to the choir around here the social determinants of health, obviously, or the model here. And what I want to do is just quickly to show you the connection to our work. So busy slide, I get it, and to do this on a Wednesday morning, probably not fair. But just want to give you a little bit of the flavor of how we actually think about it. So we all know that we have about 20%, if we're lucky, right, to actually engage with patients in a clinical setting where they're actually looking or certainly thinking about their healthcare. But the other 80% is really the percentage or the priorities that we have also called out from a health network standpoint that we also want to address, whether it's the health behaviors, whether it's the physical environment, or socioeconomic factors for that matter. And so what we have done here on the right-hand side is really call out what are some of those key efforts, or what's the role that Froedtert and the Medical College will play in each one of those particular areas. And so what you have here is that we're addressing, again, as I was mentioning earlier, from our health equity efforts to how are we a workplace of choice, right? We are an anchor institution. That's one of the pledges that we have signed. So we're part of the Healthcare Anchor Network, and we're doing a lot of that great work here locally through an intermediary called JobsWorks MKE. That's the organization that is keeping us honest about the efforts that we're driving, both from hiring locally or creating those pipelines, workforce development pipelines and talent pipelines, to how are we also engaging and creating ultimately community and economic vitality through our health equity efforts, or hiring, or what we call buying locally here as well. So those are the things that we're doing here. And so you will see that that's our role. And ultimately, we want to be a leader in this space. So for us, it's about informing the community at large, right, or working with them about this particular efforts, is about educating everyone about our strategy or our commitments and inviting them to the table to co-create those solutions. It's about hopefully influencing others to also join forces with us. This is an area, as I like to always say, and again, I know that I'm preaching here to the choir, where we do not compete, we collaborate. This is a space where we all have to collaborate, we all have to create synergies, because that's where the power lies in terms of joining forces with the other healthcare systems, the federally qualified health centers, the city, county health departments, to make sure that we're all addressing upstream and downstream this particular issues that ultimately are impacting our communities at large. And then hopefully we will be able to be exemplify that leadership through the commitments, right, or living up to those commitments. One of the things that I wanted to quickly share with you is we actually signed or came up with our own anti-racism pledge. Interestingly enough, this is actually pre George Floyd. In 2016, we actually have the death of a young man, African-American young man in the community as well, called Seville Smith. And that actually led a 3-day unrest here in the Milwaukee area that really brought us to our knees and brought us to the realization that, this community, was obviously pleading for obviously an engagement here. They were pleading obviously for their own rights, and they wanted to be seen, they wanted to be heard through that process. And so one of the things that we did as a response to that was that I said to our CEO, hey, as the academic medical center, right, anything that happens in the community will be brought, right, potentially to our facilities, and especially to that particular facility. And I said, so we can either be reactive every single time something happens in the community, or we can be proactive and be right, engage in the community fully and make sure that we are part of the solution, and not part of the problem. And so what we did as part of that was that we decided that we're going to put a stake on the sand around our anti-racism efforts and our stance overall. And we obviously decided that it was important to call out, obviously, that racism was a public health crisis. And not only did we stop there by taking a stance, but more importantly, we decided that there were going to be some key actions that we're going to take around that. And you will see those key actions in a second. But this has been part of our commitment, our journey, how we ended up upstanding our justice pillar. And know that this particular pledge that you see here, and you'll see it in a second, has become now posters that we have in every single entrance of all of our facilities. Because we want to remind our staff, our patients, the community at large, that here's what we're standing against and for, and here's what we want you to know about what this pledge means. And again, ask us how we're doing, or go to our website and you will see how we're doing regarding our anti-racism efforts as well. Something that I also wanted to connect here this morning, because I know for many of you this is also important, is, all right, so that's great, Andrés, that you guys are driving that, but help us understand how you're actually also looking at tying your efforts or your strategy to other either the accrediting bodies and or some other standards. And so here's what I will share with you regarding the Center for Medicaid Medicare Services, their framework, their health equity framework, and also the Joint Commission health equity certification. I'm going to start with CMS. Here's what it is. So again, they're giving us a framework here with 5 priorities, and they actually rolled this out or launched that in 2022. It's a 10-year framework that they came up with. And what they're asking us is, as healthcare systems, to make sure that we're using the framework and the tools to really assess, right, where we're at in that journey. And it's actually giving us an opportunity to take that deeper dive, to conduct the assessment, and then for each one of these priorities, and to really understand where are we under each one of these priorities, what are the gaps, what are the opportunities, and then for you to kind of formulate a plan on how you're going to be actually closing those gaps over time. And so again, it's about making sure that we're helping, at the highest level help our communities, right, to attain the highest level of health for not some, but everyone, so they can have a fair and just opportunity to attain their optimal health. So again, it's about health equity. And so the priorities are around, again, standardized collection. What type of data are you collecting, and how are you stratifying the data, right, to tell you a story, and how are you utilizing that to obviously then inform or guide your strategy or your efforts moving forward. It's also about looking how you are educating, right, or creating greater culturally competent workforce to deliver culturally and linguistically responsive care in all of your facilities. It's about advancing language access and health literacy and the provision of culturally tailored services. And it's also about accessibility for those individuals that have disabilities as well. So it's, as you can tell here, it's again, some of the key priorities. I know that many of you are probably have a plan around your CMS framework and standards here, but I just wanted to tie it back here from an awareness perspective on how we are again connecting some of those strategic dots on how we're actually driving this. And so know that this is actually part of the overall strategic plan and tactics that we have set forth for our healthcare system. And equally important, again, the Joint Commission, has provided also or came up with a certification. There's a couple of now of healthcare systems nationally. Barnabas in New Jersey was probably the first one that went through this certification successfully. And actually just heard a webinar that they were part of under the AHA as for the Health Equity Influencers Roundtable, where they were talking about their experience and their journey around ultimately being able to live up to this particular health equity certification. So here's a little bit about what it is. Again, it's one of those voluntary at this point certifications for health equity programs that provide structure and guidance on what we ought to be doing within our healthcare systems around our health equity efforts. And so the 5 areas that they're looking at is leadership, collaboration, data collection, the provision of care, and performance improvement. Again, and I know that I mentioned some of those from a CMS perspective too. So you start seeing the connecting of those dots strategically for both of them. And so what we have done here at Froedtert, which brings me to the slide, is really then connecting those dots at the highest level and saying, all right, so what are really the key areas or those standards that either the American Hospital, CMS, the Joint Commission from that certification, but we've also layered in the class standards, which stands for the culturally and linguistically assessment standards from the under the HHS, so Health and Human Services. We also have called those out here. And so what we have done is a crosswalk of all of those standards. And so we have it now at the highest level as part of our strategic plan that we're driving or committing to ensure that we're obviously meeting all these different requirements or standards moving forward. And again, our programming really aligns well with all of this particular efforts. Another thing that we have done is we have a number, and I know that many of you probably are familiar with many of these particular pledges here, whether it's the Healthcare Anchor Network, whether it's the Health Equity Transformation Assessment. We are also part of the Carol Emmett Foundation, which is a gender equity. So it's for women or for gender-specific gender equity pledge that we made a number of years ago. We're one of the founding healthcare systems there, where we're actually driving some of those efforts to obviously create gender parity over time here, knowing that that hasn't been the case for us on a number of key efforts. And then we have local ones like this from the Milwaukee region of choice, which is actually something that all the anchor institutions here locally made through the chambers of commerce around both workforce diversity and leadership diversity goals for for each one of our organizations. And we have to submit the data to the MMAC, and we actually are held accountable to those particular efforts based on the baseline data that we submitted originally in 2019. So again, a number of efforts that we're doing. So some of you might be saying, all right, Andrés, that's great that you guys are driving all of that, but tell me about what you're doing specifically around this effort. So here's what we're doing. Again, going back to our COVID days, obviously also the death of George Floyd, here's some of the things that we did. We decided, our CEO, Kathy, not only created or sent out a very clear and compelling message to everyone around what was actually happening and how heartbroken she was as an individual, as a leader, and what we needed to do in response to that as an organization. And so on the right-hand side, you'll see certainly here, some of the demonstrations that we had within our campus. We also held staff forums. We had community forums as well that now have turned into community conversations that we're having with very specific dimensions of diversity. So we meet with our Hispanic Latino community, specifically with the LGBT community, with the Hmong community. We meet with the African American Black community. And those are very specific conversations that we have about things that really matter to the community, things that concerns the community. And so what we do is we hear them out. Sometimes we'll come in and provide an update, but it's more about soliciting their feedback and for us to listen attentively and bringing that back to the organization and say, hey, here's what we heard. So the community spoke. What are we going to do in response to that? And so every time we meet, we'll provide an update on what we heard in the previous meeting, things that we took as homework or to-dos, and then we come back and we'll provide an update. And actually, earlier this week we had, in partnership with the Bucks, because we're the healthcare choice of the Bucks here, the NBA team, a Noche Latina, which is one of the activations. And that afternoon, prior to the game, at the Pfizer Forum in their arena, we actually held a community conversation with the Hispanic Latino community, and it was actually a great conversation around things that we have heard along the way, things that really matter to the community, and things that they wanted to hear in terms of what will be your response or how can we work with you to co-create solutions. So that's what that conversation entailed, and they were very pleased with some of the progress that has been made around those efforts. Here's a little bit more about some of the, obviously, efforts that we put in place. Again, the staff forums, community forums, also our strategic plan. I would say, again, our eradicating racism, enhancing health equity was, critical at that time because it really called out all the efforts that we're driving or that we're going to be accountable to as an organization. So a couple of things here very quickly, because I'm going to close quickly here so I can actually field some questions from you or maybe clarify some of my points. The equity, diversity, inclusion, employee life cycle, again, is the same life cycle that HR rolled out for the entire enterprise. What we have done here is to think it through that Jedi lens and say, well, what would be in here, right, ultimately for us to create an inclusive and equitable experience for our diverse staff members. And diverse, we defined by racial, ethnic diversity, from that perspective. And primarily we call out Black African Americans, Hispanic Latinos, and Hmong, because those are the three largest racial ethnic groups that reside in our area. Again, over time, we're going to include other dimensions of diversity, but we wanted to start there because that's the low-hanging fruit for us. And so we have done everything here to map that out from that perspective. We also have the BRGs working on their strategic work plans, where they're helping us, again, to solve for some of those efforts, either under the people strategy pillar or whether it's health equity. We work with, Project Search with other organizations externally, diverse professional organizations like the National Association of Hispanic Nurses or Black Nurses for that matter too, to make sure that not only are we providing those webinars or increasing the cultural competence of our staff, in this case nurses, but also as part of that partnership, they provide either workforce development opportunities or talent pipeline opportunities that we are now engaging in and really reaping that benefit. So it's really a symbiotic relationship that it's beneficial to both our partners in the community, including these professional organizations, as well as for Froedtert from that perspective. And then we have also mandated racial equity training for the top of the house. Everyone who's a VP and above in the organization have gone through the Unlearning Racism from the YWCA, and we ended up customizing that with adding a Milwaukee experience or component to that training, as well as the connection to health equity. And that is something that we've rolled out. It's a 16-hour training. It's intensive. It's actually an immersion experience, and we've done it for everyone. So 100% of all of our VPs and above have gone through that training. And now we're actually now taking it to the next level of leadership, which would be executive directors and director levels. And then we're going to roll it out to managers and supervisors as well over the next, year and a half or so. We also engage with a number of other organizations, or we show up in organizations or events, signature events in the community, like the Puerto Rican Festival, Mexican Fiesta, which probably brings about 150 to 200,000 people over the course of that weekend here to the Summerfest grounds. And we actually are there to provide awareness, education. We provide some screenings as well. And we have actually our talent team there, because one of the things that we have learned is that some people are, might want to engage and look for opportunities as well. And so we are engaging them there. And if someone is interested in a opportunity, in a career opportunity, then our talent team will be able to actually shepherd them through that process while at Mexican Fiesta, or actually get their information and then do a touch base later on. And we have seen that to be actually a game changer for us. The one up here is actually the Hmong New Year. It's another event that brings probably upwards of about 40,000 Hmong and other community members to that event the first weekend in December. And again, we are there to provide education, awareness. We provide some screenings as well, health screenings, but we also use the same or deploy the same strategy of Mexican Fiesta to look for or offer workforce or talent opportunities as well through the workforce workplace careers here as well. What are some of the things that are working for us? Again, strategic intentionality around engaging senior leaders, thinking through that equity first lens that I mentioned, creating smart goals, but we call them SMARTY. So also adding not only their specific, measurable, attainable, realistic, time bound, they also are inclusive and equitable in nature. And so that has been, again, a game changer for us, making sure that we have metrics tied to the efforts, tying executive compensation, and another piece is celebrating success. What gets celebrated, right, will get repeated. And so for us, it's really important that we celebrate our successes as well. We have CEO commitment and support, senior leadership buy-in and support. It's all about strategic partnerships internally and externally. I oftentimes will say that the best work that I do is not being the chief diversity officer or the VP of community engagement, is being the chief collaborations officer at Froedtert and the Medical College of Wisconsin, because all this work is actually owned and driven by everyone from an accountability perspective. And so not just our office. So that has been also a really great opportunity for us, or success factor. And again, sharing lessons learned, leading practices, and understanding what are some of those pitfalls too, so we don't make those or have greater awareness for future efforts as well. And then lessons learned as well, about our culture. Being comfortable with getting uncomfortable has been one of the things that has been really critical for us, creating the accountability at all levels, having the organizational or the corporate structure that we have, and where you reside matters, and resourcing this work effectively. I will say that we have doubled down on our efforts, and I have continued to increase my budget for every single area that I oversee, because again, this work is critical and a business imperative for our system. We've done it in a phased-in approach, and again, it's about a coalition building. And because of all that great work, we have obviously received some of the designations or other accolades here as a healthcare system, either locally, regionally, or nationally, for the work that we drive. And I'll close with this one here. You will see here that everything that we do, again, strategically, we touch every single part of the organization. Here's a good example of this, where we ended up putting, obviously, branding all of our vans, carrier vans, a number of years ago. And I said, well, what about if we have a couple of those key messages or taglines in Spanish or in other languages for that matter? So here's one that is actually in Spanish. And so this serves like a billboard, but also a great reminder when Spanish-speaking individuals read it and say, huh, Froedtert gets me, right? Or they care about our community. And so that would be, right, a healthcare of choice, or maybe a workplace of choice for me or for someone in our family. And this is actually some of our ads that we have rolled out. Here, the Froedtert.com/endracism is the website that if you go to that website, you will find our strategic plan and the dashboard. But one of the things that we have done with our ads here on the right-hand side is that you will see that we've added a little bit of a verbiage on some of our efforts. In this case, our cancer screening mammograms. That's actually one of our key efforts from a health equity perspective. And we're showing how we're doing in terms of those particular efforts. So we want to make sure that, again, we're educating even when we're actually producing or having this ads on our billboards or in some of the other strategic placements that we have, even for signature events in the community. And here's the anti-racism or eradicating racism pledge that I talked about. Here's the 4 key actions that we have taken around treating people with dignity and respect, examining our own biases and reducing our biases to make healthcare fair for every patient, measuring, tracking, and reviewing all of our policies. We just conducted a policy of all of our HR policies with PwC externally. They were our partner, and we have now work streams that we're working on with, obviously, with HR around some of those things that we found out where we were not being equitable, or where we found that obviously racism was thriving in terms of some of the practices that have been going on within the healthcare system. So again, now we're able to upstand equitable policies across the board from an HR perspective. We wanted to start internally facing because we wanted to get our house in order first before we do it for more of the clinically oriented and externally facing policies and efforts. So it has been a lot of great work over the last year or so with HR, and then leading change in our communities and addressing healthcare disparities. And again, being one of those, again, an anchor institution and partner in this particular efforts. And I'll close with this one here, that this is actually our North Star. At the end of the day, I think we all realize that the words of Dr. Martin Luther King still reverberate today, that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think we all can agree that that continues to be the North Star for all of us, because we know that we can do better. And we need to actually hold ourselves to that standard. So that's what I prepared for you. I'm sticking to that story in terms of our journey. And so I'm going to turn it over to you, Mandy, for any questions that individuals might have based on my presentation this morning.
Sure. I know that there's at least one question in the Q&A, and folks on the call, if you want to add any questions while I have two burning questions that I want to ask, feel free to do that or come off of mute. I don't know if Annie, you need to allow folks to be able to talk or not, but one person at least has their hand raised. Let me see. I can't see who that is. Oh, Don.
Done.
Are you able to come off mute? Let's see. There we go. Go ahead.
Sorry.
Go for it. Dawn?
Oh, I don't have a question. I'm sorry. I hit the wrong button.
Oh, okay. No worries. Okay. Then
I'm so sorry, Mindy.
that's okay. No worries. So my question, I have two questions that really I'm just super curious about. One is resourcing. Like, this is phenomenal. And I love the tie to the metrics and connecting the dots with accreditation. At the end of the day, how is this resource? Is this operational budget? How do you resource the initiatives that you're leading?
Yeah, so our D&I team receives the resources, right? So we just went through our budgeting process. We just submitted, obviously, our budget for the year, and we were able to, again, based on the multi-year strategy that we have in place, what will we need for fiscal year 25, starting on July 1st? So we were able to bake that in, those dollars or resources that we need financially, as well as if we need actually an FTE count, as well greater staff members to obviously resource this work, right, or lead these efforts over time. And so that's how we do it. Obviously, the budgeting piece, it's easier because it will go through that process. At this point, the way that it works is that gets then pushed out to all of our clinical entities or hospitals. They have to take that into consideration. We're not necessarily a revenue generating area, of course, so the system has to pay right for our services. So there's a formula where every single hospital or the ambulatory takes a percentage of the corporate services, and they bake that into their budget. So we obviously can stay budget neutral at best, and then continue to serve as a corporate function for them. So we get those resources. Again, we have not had an issue there. And even in terms of the FTE, so point in case, when I was mentioning even Eric Guerrero, who's our patient equity manager, program manager, that's an FTE that we were able to bring on board last year. Because again, one of my directors actually said, hey, I'm doing double duty or wearing three hats. I can't, do it any longer, and it's not sustainable. It would be great if we can get an FTE that would be dedicated to our patient equity efforts, or health equity efforts for that matter. And so we were able to go quickly through the labor, we call it here OEC Labor Committee. That's a committee that will then allow us to make our case, and then you get the FTE or you don't. But again, because we're driving this strategically and it's one of the major initiatives, it gets treated as such, where again, our CEO is extremely committed to this work. We're not shying away from it. We're doubling down. As a result of that, she understands there has to be greater resources. So Andrés, you and your team are equipped to actually lead or co-lead these efforts with others. So that's how we do it here. But again, we also, part of that formula too is collaborating, right? So for example, with the CMS and Joint Commission, I'll close with this comment. We work with our folks in quality. We have someone in quality that it's well-versed, and it's actually our liaison with the Joint Commission. So that person is part of the cross-functional team that we put together that is actually now shepherding the organization as a whole to go through the CMS framework and standards there. And also, the the crosswalk that I just showed that also has the class and the CMS and you know, the AHA ones as well. So that's how we do it. So we bring other thought leaders, right, or areas that also should be involved in this process. And then we delineate, again, I'm the convener, I'm the executive sponsor of that work, ultimately, per our charter, per our diversity council, but the whole team is working on those efforts and everyone knows what's expected of them. And we do it honestly as a team. It's really all predicated on a collaborative approach here.
That's fantastic. I'm so impressed. Lisa has a question in the chat that was my second burning question. She asked, you mentioned identifying and correcting racism within the system. Do you have any examples of policies or practices you changed? And I'll just add, that was my question. Plus, I was interested in the process of the HR review and like how that rolled out so that you could identify those areas that you wanted to change.
Right. So what we did is we looked, again, we worked with our CHRO, with Eric, and with the HR executive team, because we have different leaders within HR that actually own, right? One owns talent, the other one owns, it's our chief cultural learning officer. So what we have done, or we did, is that we talked to each one of them. We let them know that we're going to be, obviously, and they have been involved in this process all along. So it was more of a reminder of, hey, we're going to be conducting the audit this year. HR will be phase one in this process. So we're going to be bringing in the consultants. Again, we selected PwC, PricewaterhouseCoopers. They actually probably are one of the firms out there that have done this work effectively, especially with healthcare systems. And so we were able to work with them. We put together the scope of work there. And then once we signed that agreement, we brought them in. We had a kickoff meeting with everyone, all of our entire HR executive team. Part of that launch was we're going to review every single policy that we have, from workforce development, or talent delivery, as we call our talent acquisition, to, again, learning and development, to our benefits and compensation, right? So we looked at all the policies there, and they looked through a Jedi lens in terms of what we had in terms of language. And so, for example, a good thing, a good example of that is we found out that as we were actually conducting our policy review, one of the things that we found, for example, in talent, is that as we then took the deeper dive, that all of our job descriptions across the board actually were requiring that you had to have a college degree or a technical degree to work in healthcare. And we're like, really? In 2020, 2024, we're actually now using that as a knockout to actually exclude people who might not have a degree, but bring a ton of experience, right? And so we were able to scrub all of our job descriptions, also look at language that is actually embedded in our job description to make it much more inclusive and equitable in essence. And then the actual process itself, where we were actually, for example, hiring, right? Where were some of those pools? I actually use a lot of fishing analogies. So I said, well, where are we going, right? Who are we partnering with? And so I was dumbfounded. I'm like, why are we connecting with this diverse organizations, right? Or with the community at large? And so, for example, with the Healthcare and Care Network and the work that we're doing here locally, now we have adopted zip codes. And so we were able then to conduct career fairs within the community with a couple of our trusted partners in their venues. And we're seeing, right, greater reception to that. People are showing up, people are engaging with our recruiters, and we're able to interview and hire on the spot these days versus getting them through the process, right, of having them go through our website, which becomes a very daunting and scary process. And so, again, that was part of what we have done. And it's all about, let's make sure that what is it that we're doing ultimately in terms of behaviors and actions that actually are keeping us honest to the pledges that we've made here, or commitments. But also, let's look at the policies and the practices that we have, and where have we obviously not being inclusive and equitable in essence. And part of what we have found is that some of our policies were created back in the early 80s or even 90s, and they're not equitable and inclusive policies. And so we had to go back to the drawing board and say, we're not going to continue to use this policy, or let's actually look at an equitable and inclusive way of upstanding this policy moving forward. And then what are the practices or the approach given this new policy? And so a lot of that, again, is the work streams that we have in place with, again, HR is driving that. I'm just the convener. And we have a touch point every month where we're reviewing each one of those work streams. Where are we in each one of them? Where have we made advances? Where are we running into roadblocks? What are those roadblocks so we can actually remove them or address them as we go on? But all of this work ultimately then gets rolled up into our diversity council so we can take all of our priorities there.
That's phenomenal. I am so energized by you, and your passion is obvious. I'm going to close us out because I have an offsite meeting at ASCO that I'm a few minutes late for. But I really appreciate your time. This is recorded and will be made available broadly. I'm sure people will have additional questions about kind of brass tacks implementation of
Yep.
like, how do you
Yep.
actually get stuff done?
Yep.
So as I receive those, we may connect folks in our task forces, to you, if that's okay, just to, as you said, collectively, we're in this together. We're like, this is bigger than any of us, and it's not about competition. It's about figuring out how to collaborate and make some real change. So thank
Absolutely.
you.
Well, thank you for having me, Mandy. Thank you all for joining. And by the way, if you don't have the slide deck, I will make sure that Carol will send it to you so you can also share that widely with anyone who would like to have access to it as well.
Awesome. Thank you so much for your
All
time
right.
today, and thank you all
Thank
for
you.
joining us. Have
All
a great
right. Take care.
day.
Bye-bye.